Dr. Rob here. Hello, everybody. Excited to be here. Once again, I'm in the office. As we all know, I spoke to you guys before. Monday and Wednesdays, I'm in the office. 1 o'clock was a little difficult because I had something to do, so we're going a little earlier. Sorry for the surprise. However, got a lot of good stuff to share. Again, we're trying to do a Facebook Live every weekday, Monday through Friday, as you know, 1 o'clock to 1:30. We're a little earlier. Tomorrow, and I'm going to announce it a couple of times, tomorrow we're going to have Dr. Brent Doverl from KBMO, and we're really going to talk about the antibody tests. And we're going to talk about, I just had a patient get a positive IgM and IgG. And she was very concerned, and well, she should be. She went and got the swab test, and it's negative. And she says, well, what do I believe? And that's a problem. Where do you go? What do you believe? And what she has is she's having this antibody reaction, but she no longer has the virus present. She's almost done. And that's where we are, assuming both tests are correct. There's a 95% compatibility between the tests with KBMO, and you're going to hear all about that tomorrow. And we'll go over case scenarios. We'll talk about spike proteins and everything. So feel free. I know I'm a little earlier. Reach out, shout out. I'm all by myself in the room. I am tech savvy. And again, let me know that you're there. Feel free to ask questions, like, comment, share. Please do me that favor. Got a little itch, not supposed to touch your face, but got all the wipes, the mask, the splat mask, the silicone mask again, the gloves and all that. So today, I want to talk a couple of things before we get to genomics and genetics. I think this is of great interest. We hear a lot about testing, and a lot of testing in the U.S. As everybody knows, I'm in Westchester County. I'm right by the epicenter. What was the epicenter in Westchester, and 30 minutes outside New York City. So interestingly enough, I have some stats here where the rate of COVID testing in most impacted countries worldwide as of May 11th, 2020. So we hear a lot of rhetoric, we hear a lot of numbers, but let's go through the number of tests performed per million of the population. So number one, believe it or not, is Spain. They're at 52,781 per million tests per million population. Portugal is actually number two at 50,767. Well, when we go down, I have to flip the page. The U.S. is ninth at 28,533 per million, so we still haven't caught up. We started a little late. The U.K. is 10th, and the worst in the bunch right now was 13th. They only did 13 entries, believe it or not, was Peru. So clearly, this is of concern. We're not testing enough. And so people always ask me, what do you think? I do believe in the social distance. I think that's good. You guys see that I'm wearing all the different attire. I don't necessarily think that there's anything wrong with going back to work. We want to work. We've got to get it going. I think we need to be cautious. I think we need to understand the beast, if you will, the monster. And but that doesn't mean we stop. We're Americans. We thrive. We go forward. I'm here again 2 days a week as we rebuild confidence and let people know that we're here. And I think the testing is a great thing. And once again, I'm starting to see many more people pop in. I caught you by surprise. Tomorrow, it's going to be at 1:30. We're going to be a little late. Tomorrow, 1:30, I'll put a little Facebook announcement. Dr. Brent Doverl is going to be going over all the antibodies with me, and I know everybody had a lot of questions. When Brent and I were on and I had to follow up the next day, that was my two most watched videos of this last 2 month COVID-19 kind of role. Having said all that, we covered this. Again, shout outs, give me a call. Feel free to do that. Got a great article here on research reports in clinical cardiology. The title is, it's funny, it's all the way back in March 2011, The Western Diet and Lifestyle and Diseases of Civilization. So I found this older article, Let me read you the conclusion, and let's see how it plays 9 years later. The adoption of diet and lifestyle that are very different from what shaped the human genome for more than 2 million years is a major factor in the widespread prevalence of chronic degenerative diseases that are endemic in Western countries. This conclusion strongly suggests that focusing on an isolated dietary or lifestyle variable is not appropriate preventative medicine strategy. So let's get to that. I'm going to sit back and relax a little bit. So what is that saying? Well, we have our genome, and that kind of sets us in. Our genome is our effect of our genes. We have something called epigenetics. We have genes. We have all these different things. And next week, really to talk about epigenetics and genes, I'm going to have Dr. Erica Gray from Toolbox. We're going to go over a whole bunch of things. This is sort of a preview. There's a lot of interest in it. So I'm going to share that with everybody. So basically, our ancestors and our forefathers really spoke to the idea they ate, hunter-gatherers, and they ate what they could, but what they had the opportunity to eat was perfect for their genome and their environment. Our environment and our genome hasn't changed that much. We're changing our genome, but our diets have grossly changed. We have all these man-made foods. We've affected the soils. So that leads us down a path of not having good health, and that was documented 9 years ago. So in a time of a health pandemic, there's nothing more important than eating a good, healthy lifestyle. Just remember, I've said this before. Jack LaLanne said, if man makes it, I won't eat it. That's my number one diet suggestion to everybody. I always tell everybody, do me a favor, use the U shape of the shopping mall or the food store. So the U on the periphery is where you really want to buy food. In the middle is all the processed food because they always try and herd you towards the middle. We always, when we go shopping, stay on the outside. So that would be a great choice. Having said all that, clearly we're changing our genetics, or we're not changing it for the better. So that poses an issue. So just I'm trying to hit a few quick points here. And that's one of the points where our lifestyle really depicts our genetic outcomes. Genes are not your destiny. They load the gun, but they don't fire the gun. Your environment, what you do. So people come in all the time and say, well, my family's heavy, so I'm going to be heavy. Well, that's not necessarily true, because when I tested my genetics, I should be heavy. I should have a lot of leaky gut, and I don't, because I changed my lifestyle. I keep my environment in such a way, and I value health. And food, as I've said before, is a potentiator. Bad food is a potentiator for inflammation. Good food is a potentiator for inflammation. So that is something that we've discussed before. What I wanted to get to, since it's going to be a short Facebook Live today, I wanted to talk about your genetic capacity to have lung issues, or what we call a respiratory resilience panel. This respiratory resilience panel is interesting in that these are traits that may affect you. So they're testing traits to see if you have a propensity towards lung inflammation. Amazing. So I love this test. I've been giving a lot of my patients this test because they're like, all right, I'm negative now for COVID-19, so what do I do? And what they test for here is overall respiratory resilience. Is they're testing for glutathione, the master antioxidant, test for inflammation, see if you have a susceptibility to inflammation, oxidative stress, see if you have the ability to deal with oxidative stress. Obviously, oxidative stress poses a major issue. Selenium. To me, selenium is the missing mineral. Blood pressure regulation. We all know that hypertension it poses a major issue, in that if we have hypertension, it's the number one comorbidity that leads you to hospitalization. Glucose metabolism. Well, we all know that glucose poses an issue. If you can't metabolize glucose, you're going to have a major issue. And we saw that just a 10 millimole drop in glucose led you down a path of true health if you had blood sugar dysregulation. Vitamin A, vitamin C, all great vitamins. Vitamin A, we all know for the immune system. Vitamin C is just a critical vitamin to help and open the gates to the immune system. D3 is a tremendous regulator of the immune system, and zinc is the gatekeeper to the immune system. So thanks, Elias. I appreciate that. Let me hit you with the like. So like I said, I am all by myself. You guys should be happy. I don't have anybody helping me today. I decided to do this all on my own. So let's get into, and I'm looking right at it, and this is something that you would receive if you came in and did the genetic test, the inflammation susceptibility. So here we're looking at SNPs, single nuclear polymorphisms. So there's just an aberrant change in the gene. And that aberrant change can lead you down a path of susceptibility. Susceptibility in this particular panel to TNF. So TNF alpha is an inflammatory pathway. And you don't, without question, want to stimulate that. So do you have this SNP to express this gene or overexpress this gene? We also have IL or interleukin 6. We all know that interleukin 6 has been implicated where? It's been implicated in a cytokine storm. That poses a major issue. So that cytokine storm can really elevate if you're not able to handle your interleukin 6. So we have inflammatory markers, the different TNFL and the different interleukins right here. So this would be your inflammatory susceptibility during the time of COVID-19. Again, looking at your respiratory panel, your genetic test. Having said that, blood pressure regulation. Now you have your ACE2 or your ACE2 inhibitors. They're right here, your SNP. And you have other ones where blood pressure would be a major issue. So the synopsis here is that we do need to test. We need to continue to test. People need to understand the test. They need to understand the PCR. They need to understand the antibodies. They need to understand that there's poop tests now, because you shed the virus in the first few days before symptomology and 28 days after the abatement of fever. So you need to understand that how both tests mold. You also need to know if you can get a stool test, a poop and scoop test, if you will. There's also this genetic test where you really see a genetic propensity or genetic susceptibility to having a lung issue. So we have a multitude of issues, not only in the office, but a multitude of tools that we can give and share with you. Now, I had some email questions about that, and they said when you take a genetic test, how do you do it? It's a cheek swab. So it's not like the PCR swab. The PCR swab, you go up, it can be a little uncomfortable. This is just a cheek swab. You go in, you send it in, you get the information back in about 2 to 4 weeks. So that's a great thing to do in the functional medicine world, and I implore all my functional medicine, functional nutrition docs, without question, to do these genomic tests. Another question that was emailed yesterday and said, would you do the PCR test first or would you do the antibody test? Well, it really depends. The PCR test essentially tells you if your virus is present right now. The antibodies talk about a part of your immune system reacting, and also if you've memorized the reaction to build, like IgG is a memorization of a reaction to the virus. And then you, with an expression of IgG, you're going to be able to show people the ability to possibly ward off this virus, at least for a year that they think. So I wanted a quickie today. Normally we go about 30 minutes. I wanted to do a little quickie. Tomorrow again at 1:30 we're going to have Dr. Brent Dover. I love all the questions that you send. I really appreciate all the kind words that everybody's been sharing with me. We've been very consistent for the last 2 months. We're not going to give up on doing them every day during the week. Of course, we always have our affiliates, Mike Powell and Mike Warren of Creative Chiropractic. And of course, we got Dave Donahue and Veronica Hope of 8 Weeks to Wellness and a whole bunch more. Our Codia Laser has been great. They're always willing to help us through this time of need. I'll be doing a huge announcement, a huge webinar for their brand new laser. I'll share that all with you, and I'll share you a link that you can watch it. And having said all that, I really appreciate your time today. Sorry about a little different timing. But again, tomorrow at 1:30, my pleasure. Dr. Rob, always yours in health.